United Way has been involved in early childhood education, and in particular quality child care, for several years now, since we really determined that only 17% of low-income children had access to quality child care, and that means child care that even met basic health and safety standards. We have known from a large body of research that children that do not receive a high-quality early childhood education are much more likely to suffer problems that will keep them from self-sufficiency, things like not graduating from high school, becoming a teen parent, and even committing a violent offense. So it was our goal to really get all of the low-income children, the most vulnerable children in our community, that opportunity to succeed long-term.
So that's a dream that I think of quite often. The reason we're so passionate about this work now is because our expectation is that these kids will be graduating and they'll be going on to college or some other vocational career training, whereas before they might have been dropping out in 9th grade or 10th grade. And so the hope is that we are changing the trajectory outcomes of these children today. When you affect the life of one child, you then affect that child's family, not just his immediate family today, but his wife and his or her children, because the greatest indicator of school success is the education success of the mother or father. And that is a critical piece that we're affecting today and for generations to come.
I think that the child care reform legislation that passed this year is a huge win for the young children of Indiana and for their families. And now, starting in 2015, we'll have assurance that children are in safe child care, and that the quality levels of these child care programs will continue to increase with the help of organizations like United Way, and that children will be better prepared for school.
1004 is a wonderful bill that allocates or brings additional funds for vouchers. And what that really means is that more kids who don't have funds today to pay will be able to afford to go in the future. And those funds will be directly available for providers to apply for and allow children who don't have funds today to be able to go. Now, it's only a $50 million bill, and so it's over a period of time, and so it's limited in what it can do. But it's a start, and our goal in the future is to continue to expand the amount of funds available.
I think one of the greatest things about 1004 is it demonstrates that there's a growing awareness, certainly in business and also among our legislators, that we really need to do something to improve the quality of care for children. And so 1004 was backed by the governor, and I think that says a lot in itself, that he's using his leadership to do something positive for early childhood education for the underserved.
It is my great privilege as Governor of the state of Indiana to share with all of you what I believe is a truly special moment in the life of our state. It is a moment where we begin a new chapter of hope and opportunity in the lives of some of our most vulnerable children. As Indiana, for the first time ever, will fund quality pre-K education so low-income kids can start school ready to learn.
There's going to be up to 5 counties that's going to be selected for this pilot program. And what I also like about it is we are attaching the path to quality. You have to be approved at the level 3 or level 4 path to quality in order to qualify for the funding. And they also have to agree to administer the kindergarten readiness assessment as well as have parental involvement, which I think is also key.
House Bill 1036 basically requires all providers who receive federal tax dollars managed by the state to maintain a number of new requirements. They must maintain proper child-to-staff ratios, in other words, having the right number of caregivers for the right number of children. They must not exceed maximum group sizes. The staff are going to be required to be trained better. They're going to have 12 hours of continuing education on age-appropriate development of the children, in addition to the training they already received that was passed last year in terms of safety and care of the children. There's also going to be a provision that proper nutrition and daily activities are provided for the children, so that we don't want just a bunch of children who are appropriately managed by the right number of staff who are properly trained. However, they're doing nothing all day but staying in their playpens or booster seats. So this way, the children are going to be required to have opportunities to promote their play development as well.
I find it ironic that we actually regulate food standards and standards for restaurants. You can't go to Lucas Oil Stadium and have different standards than you would at your, local restaurant. We don't fund those necessarily, but we have standards that they have to abide by. How can you, one of the most vulnerable, the children, how can you not have standards in those facilities, but you have them in other facilities? And the other thing, it's not like we're asking for anybody to do anything that they wouldn't want to have in their own home. Why wouldn't you want to have hot running water? Why wouldn't you want to have clean floors? Why wouldn't you want to make sure that your children are being cared after adequately? And why wouldn't you want your children to learn something? We don't want to support glorified babysitting. These are child care centers that are supposedly supposed to have some type of educational component to them, and we wanted to make sure that they had those.
I think that often people grow up in backgrounds where they, had a parent or relatives looking after them. And so, until someone realizes that's not real life for many families, they don't have options. It may be a single parent or both parents. Often, 70% of parents with young children, both are working. And so they need options for their child care. And frankly, we also need those parents to be in the workforce if that's what they choose to do. And they need to know that their kids are in a safe environment so they can continue to work and provide for their children.
We've all heard horror stories about daycares, licensed and unlicensed. We want to make sure that if we're spending money in those daycares that they have to meet minimum standards. You can't have money being spent from the state and not have at least some minimum standards that people should abide by. We could, if we wanted to, we could regulate every daycare. This bill didn't do that. If you are private pay and people don't want to take CCDF money and the daycare doesn't have any CCDF recipients, they don't have to abide by those standards. Now I would say that I would question whether or not I would send my child there, but that's the choice that people have, and we didn't want the government to get into that.
What Bill 1036 does is it forces any child care provider who receives those voucher funds, those CCDF funds, that those child care providers must provide high quality child care. So all of a sudden, yes, you're putting more funds into it, but those funds are being directed for low-income families so that they can have a high-quality child care space. Otherwise, without those two working together, your outcomes would be no different than they were 5 years ago.
I do believe that when it comes to our most at-risk, low-income kids, early learning programs can and do make a difference between a lifetime of success and a lifetime of falling behind, dropping back, and sometimes dropping out.
This idea had very broad bipartisan support, which was very important to its success. And nothing happens to change laws without incredible leadership at the political level. So we are very thankful, number one, for Governor Pence's vision for early child care and his critical support for the issue.
Very good bill, in my opinion. It came with large bipartisan support. With 115 votes that came out of this, and I'm very proud of the work that was done.
When business gets behind an initiative, especially an initiative that you wouldn't necessarily correlate with big business, like early childhood education, then clearly they're saying there's a need here that we need to fix. That was a group of people from Central Indiana Corporate Partnership and also United Way of Central Indiana. There's no doubt it was impactful. The legislators listened when voices such as those that are so highly regarded in this community speak up and say, we need to fix this.
I think it's important to have people like the United Way and the Chamber of Commerce and other, what I call the big companies and the big policy makers in the state to have a role in this subject. They are the ones who provide the data that shows what a successful program like this would do.
When the United Way of Central Indiana and many other groups and organizations and many of the CEOs and presidents of some of these major corporations and businesses, who's your businesses that you're talking about, when they came to the table this year, it was a game changer. It made a lot of difference. We had Democrats and Republicans. We had people from the left and people from the right that came to the table and says, you know what? I now see and understand the issue and what it is we're trying to accomplish here. And again, to sit here and get a total of 115 votes out of 150 lawmakers on an issue like this that they've been trying for years and years to accomplish speaks a lot. I think it speaks a lot to the people like the United Way of Central Indiana and all the groups that came to the table. It made all the difference in the world this year.
Imagine 15 years, 20 years from now, if all people in Central Indiana could afford or could find quality child care at an affordable rate so that they could be confident when they go off to work that their children are not only just taken care of and safe, but are being prepared with excellence for an excellent school system that will allow them to grow and be ready for college, a career, or whatever they choose to do. Life is so bountiful if you have lots of options. And what this does in the very beginning of life is to give children the potential to have options when they're older.
The most rewarding aspect, I would say for me personally, is to see systemic change created. It's wonderful to help high-quality centers that are serving the underserved, but I would like to see every child have the opportunity for a high-quality early childhood experience. And ultimately, one of the reasons that PNC adopted this as a key cause is for us to have a strong workforce in the future. We really need to make sure everybody is prepared when they enter school so that instead of being 18 months behind and ultimately often dropping out, they're able to go in and be successful in their education and also ultimately in their career. And that obviously leads to a productive workforce, and that's something we all need for the future.
The success of our community long-term really depends on having a community that thrives, and there is nothing more important to the future than having children that succeed. So this is a big win for the children of Indiana.
United Way's goal of helping children be ready to learn for school and ready to earn in life is a big one. And there are many things that United Way is doing to improve education in our community. And there are many great accomplishments that United Way has had through its agencies, through its education program. But I would point to this accomplishment, the passage of this legislation, as one of the most, if not the most, impactful accomplishments that United Way has been able to contribute to. Because it will mean that thousands and thousands of young children, year after year, will be safer and will be in high quality child care. And United Way had a significant contribution to that.